coronavirus. It is important to note that this community engagement strategy also has a role when it comes to home-based care and isolation. As you're all aware, we've recently launched our home-based isolation and care protocols, and this has been in conjunction and in line with WHO guidelines and international best practices. Our numbers of positive cases have been increasing, and of course, as you're aware, this has been a threat to our health system. And so home-based care approach and isolation comes in handy to help reduce the burden at our hospitals and to enable us to be able to continue serving Kenyans, considering that we still do have all other conditions that we need to meet in terms of our health systems. We are aware that counties such as Nairobi, Mombasa, Busia, and Kajiado continue to experience an upsurge of infections, with majority being asymptomatic, and again, lending credence to the need of rolling out and ensuring that our home-based program is practical. The success of this program, nonetheless, will require the active participation of each and every one of us, starting with the patients, to the caregivers at home, our mothers, our sisters, community health women who we know. And so we are working to ensure that, again, that the role of the community, the role of you and I, is enhanced as we move forward in the fight against coronavirus. There are other key community structures that we plan to employ, particularly our community health committees. And at this point, I would challenge each Kenyan to really ask themselves, have they engaged with their community health committees? These committees are present across each and every county and are there to facilitate, one, in terms of our community health strategy approach, and now our home-based care approach. We do also have the Nyumba Kumi initiative. We have estate management committees. We've seen a lot of estates come up with innovative mechanisms of controlling this spread of coronavirus. And of course, we have the local administration across the country. Coronavirus. Appeal to all Kenyans to embrace the containment measures because these are crucial in terms of curtailing community spread and suppressing the pandemic. With regard to our current COVID-19 numbers, today we have recorded 59 positive cases from a sample of 2,354 samples tested within the last 24 hours. This therefore brings to total our number of positive cases in the country to 4,797 cases, out of a total number of samples tested so far being 142,366. All the 59 positive cases are Kenyans, with 47 of them male and 12 of them female. The youngest is a 7-year-old and the oldest is 67. With regard to distribution across the counties, we have Nairobi taking the large share at 28, Mombasa at 21, Kilifi at 3, Kiambu at 2, Machakos 2, Kisumu, Bungoma, Uasin Gishu all have 1 case each. And in terms of distribution by sub-county, in Nairobi the cases are 7 from Dagoretti North, Kibra 5, Embakasi East 4, Embakasi North 3, Westlands 3, Embakasi West 2, Embakasi Central 2, Roysambu and Makadara each have 1 case. In Mombasa, of the 21 cases, in Kisauni we have 8, Likoni 5, Mvita 3, Nyali 2, Changamwe 2, Jomvu 1. And in Kilifi, the 3 cases, we have 1 each from Kaloleni, Kilifi North and Kilifi South. And in Kiambu, the 2 cases, 1 from Kiambaa and 1 from Thika. In Machakos, we have the case in while in the cases from Turbo. We are delighted to inform you today that we've discharged 73 more patients from our various hospitals, and this brings the total number of recoveries to 1,680, and we continue to express and share gratitude with our healthcare workers for this commendable work. Unfortunately, however, we have lost 2 other patients from the disease, bringing our total fatalities to 125. And our deep-felt condolences and prayers go out to those who have lost their loved ones. And finally, we would like to reiterate on one issue concerning the cross-border truck drivers. We are still experiencing a huge pileup of trucks at our borders, particularly in Busia. And this is caused by drivers who may be flouting our guidelines. And as we stated before, the truck drivers must have a COVID-19 test at least 48 hours before they commence their journey. And this will allow those who test negative to have seamless movement across the border. I do urge all truck drivers and truck owners to cooperate for the free and smooth movement at our borders. Thank you. We now welcome questions.
My name is Dorcas Wangera from Citizen TV. I have two questions. One, what is the true status of our capacity in terms of isolation centers? And the counties had been given a 30-day directive to have 10,800 beds cumulatively. How far are we? And then secondly, you've mentioned behavior change. And what we are seeing from many Kenyans is that there's been the disregard that we have in power who all of them. What's your strategy for that specifically?
My name is Purity Musel from KBC. I have two concerns. One is there was a promise on an update on whether the numbers are increasing or reducing, because it's hard to tell with different samples that are being tested every day. Probably you can update us on the graph right now. And then number two, on the home-based care program, there are already patients that have been discharged for this program. How is the Ministry of Health able to monitor that actually they are following the protocols provided for both patients and the caregivers?
Thank you very much. My name is Emmanuel Toff from KTN News. Yesterday we got 260 cases. Today we have 59. Why the drop? Do we have a shortage in samples or in the reagents? That's the question. Thank you.
Helen Aura from NTV. My question is regarding flight attendants, the incoming flights which have been bringing Kenyans from different parts of the country. We've seen that there are some certain flight attendants who are complaining that they've been forced to go into isolation in terms of quarantining in hotels, but the passengers themselves have been told to go to self-quarantine in their homes. Why is this the case? Why can't the flight attendants also go self-quarantine in their homes as well?
Kamhaimba from Ebro TV. My question is, we are actually at 101 days since the coronavirus hit the country. For the first 2 months, do we still have patients who are still receiving treatment for the first?
This question regarding the status of isolation centers. Indeed, in the last summit that was held with His Excellency the President, county governments committed to putting up isolation centers that have at least a bed capacity of 300 per county. And I'm glad to report that we are actually working collaboratively with county governments. Some counties have already made great progress in that space, and others are, trying to enhance their measures in terms of ensuring we reach that target of isolation facilities. We will be looking actually within the end of this week to have a status update from each and every county where they share their baselines to where they are right now, and also what extra support may be required in terms of ensuring that they're able to meet that deadline. And as this goes on, we're still ensuring that we're using the current isolation facilities that we have in place, and most importantly, leveraging on the home-based care, which has come in to actually relieve that pressure load in terms of ensuring that there's continuity in the health system. I'm sure the DG will be able to highlight further in terms of where we are per county, but if you give us some time, by the end of the week, we'll be able to give you a status report per county in terms of the 47 counties. Like we said, behavior change is very crucial, and we firmly believe as a Ministry of Health, and we've always said from the beginning, that each and every one of us is a social vaccine for coronavirus. And so it becomes important to bear that personal responsibility. And I'm sure yesterday our Cabinet Secretary was able to emphasize and to call on all leaders to be able to adhere to the protocols. follow on just because I told you to jump off the building. And so it becomes important to remember you need to protect your health as an individual. And yes, it is important that our leaders are there to provide guidance, but you also have to remember that you are your own person, you are your own leader, and you need to take care of yourself and protect yourself and your family. And so we continue to call on to adherence, we continue to call on to responsibility as we try and effect behavior change. Additionally, we are looking at revamping part of our communication to really bring up the face of coronavirus. We've noticed there's a lot of cynicism and perhaps in terms of trying to bring forth those stories in terms of where we've had successes and to have more faces really be champions for us in terms of this fight. With regard to the numbers increasing and reducing today, it's important to note, and we've established, that community transmission continues to be a challenge in the country. And just because you're seeing 59 numbers today does not mean that now the scourge is, going down. Remember that every time you pick a sample, for those of us who have looked at samples and distribution, there is a probability of the type of, samples that you'd get in terms of positives and negatives. So it is not every day when you see us, having 2,000, 3,000 samples that you expect, a commiserate 200, 100 numbers. But again, the DG will be able to highlight this to you. And again, at the end of the week, we will share, again, a thorough presentation in terms of how our curve looks like. With regards to our home-based care protocols, I must say we are happy in terms of the success that is going on there right now. We've had some discharges. I'm made aware of some success stories where some families have actually been able to go through that and well and are testing negative. And we've even had going home this quarantine in their homes. It becomes important, though, going further as a Ministry of Health to continue sharing with you how best can you actually effect home-based care in your household. We have protocols, they're available in our website, but in the coming few days, again, we will purpose to ensure we actually have more practical ways of sharing those stories with you as to how you can actually set up your household and home in terms of home-based care. With regards to I think there was a question in terms of our flights and our protocols when it comes to our air crew. Again, this is a matter that is jointly being handled between the Ministry of Health and that of Transport, recognizing that in any setting there are high-risk groups. In terms of, for us, we'd consider, for example, a doctor a high-risk group. We'd consider flight attendants a high-risk group, considering they're shuttling in from one country to another. And so it becomes important then to really have a more stringent mechanism of ensuring that they are being monitored and that upon discharge they are able to then to continue with their duties. But this is a matter, that being said, that is under continuous review with the Ministry of Transport and, of course, with the airline crew themselves as stakeholders to ensure that we keep our passengers safe, especially those who are coming in and those who may be going out. So it's a matter that we've been looking at. I think I've been able to touch on most of the questions, but I'll ask the DG to add in terms of the areas I have missed out, and we'll continue. We'll get another round, Purity, right after the DG clarifies.
How many discharges through the home-based care
program?
program?
That's okay. Yeah, we'll touch on that. Thank you, Purity.
Thanks, Madam CS. Just to add on to what CS has said, facilities, governors. We had a meeting, a virtual meeting of the cabinet subcommittee, and as at today morning we had received reports from 40 counties in terms of the progress that they are making in terms of setting up the isolation facilities. But remember, it's not just a question of structures, physical structures, because you also require human capital to be able to offer the services when you have the required bed capacity. So it is not just a question of establishing the beds. We are looking at a number of healthcare workers who are trained on case management, how many counties have established rapid response teams to be able to ensure contact tracing takes place, enforcement of the containment measures, and inter-county movement in case we lift the measures that are in place. So Thursday, when we meet with the governors, we'll be able to give you a fairly good status report as to the progress that has been made in this area. For the home-based care, Of course, we told you even yesterday when we were here that we have put stringent measures in place to ensure that we have a robust monitoring and evaluation system in place to be able to inform us on how the process is ongoing. And as at yesterday, we had 550 people who had been taken for home-based care and 50 discharges. I don't have the figures for today, but by the end of the day, we can be able to share. In terms of our numbers, our figures are still on an upward trajectory. There will, of course, be differences in day-to-day in terms of numbers and cases. But if you look at the overall pattern, the figures are still on an upward trajectory. And this will, of course, continue until we reach our peak, after which now the numbers will start going down. An abridged version of the home-based care guidelines in a local dialect, and this is one of the things that we are going to discuss with the governors this week, so that people can be able to own these interventions, because for home-based care to be able to succeed, you require personal responsibility of that person or individual under home-based care. For the cruise, we have had a discussion with the Ministry of Transport and Kenya Airways. The flight attendants actually go for quarantine in hotels basically because of request of the employer, the airline, because if they do that at the hotel, they can be able to crew another flight rather than taking them home, in which case they must finish the 14 days mandatory quarantine period before they go for another flight. So that was based on a discussion we had with KQ, and because we can be able to supervise and ensure compliance, we agreed that the KQ or the airline staff be quarantined in hotels so that they can be able to do more flights. I think that marks it. We can have another second round because
we've continuously been seeing political rallies.
Zainab Mohammed from TV47. My question is about a concern that has been raised over and over about we've continuously been seeing political rallies or political gatherings that are not following social distancing rule or even following the 15 number of people rule. So, and we've also seen Mwananchi gatherings as such, people being arrested. So my question is there double standards when it comes to political leaders? Thank you.
Just a follow-up. Maybe I'm just asking whether we do have a patient who has taken more than 2 months, maybe before recovery. Yeah.
Okay, great. So that's a very important.
To note that this being the 102nd day in response, from the physiology, pathophysiology of the disease, how it evolves, it would mean that that would not be true. However, there's a caveat that you could actually have tested positive, gone into treatment, tested negative, gone home, but also come into contact with another positive and therefore become a subsequent patient. And it's important to note that this disease is new. Lots and lots of studies are going on across the world. Does having an infection actually confer immunity? Does that mean that you are safe? Say to continue, just because doesn't mean you stop washing your hands, doesn't mean that you stop observing social distancing measures. In fact, if anything, you need to be more careful. What I would like perhaps in a few months is to have a more quantitative and scientific answer to your question. But as it stands right now, and the DG will bear me witness that there's really no, clear data as to whether once you're negative, once you're positive, then negative, that you have immunity. And that once you're positive, 100 days later, would we be able to confer that to your first positive exposure? So it's still an answer that is out there in the air, and more studies and data is underway in terms of collection to give us a determinate answer. The second question by Zainab, I think I'd relate to the first answer that I gave. If I all said, let's run up to the top of Afia House, 7 floors, and all jump, I'm not sure if you'd all follow me. So it becomes important to remember it is your duty as an individual, to ensure that
you're adhering to the containment measures. And again, it's a subsequent duty of our leaders to ensure that they're able to set that example. As we've said, and I think continuously, the Cabinet Secretary has been able to say, in places where you have to work, where you're having to have, a few number of people coming together, much like we are here today, we are more than 15, it's important we put in place those measures in terms of social distancing. And I can see some of you now spreading apart, indeed. So it becomes important to take up that responsibility. Let the DG perhaps talk on the pathophysiology of this disease.
Thank you, Hayemba. I think that is a very pertinent question. We have had cases of patients who continue to test positive 5, 6, 7 times. That is a timeline of even 1.5 months to 2 months. But recent data from WHO actually indicates that despite the fact that these patients test positive, they are not able to transmit the virus to the other person. So this is what actually mitigated the new guidelines that we have in place of 10 days and 3 days of no symptoms. So basically leaving you for discharge after the 14th day. The fact that you show a positive test, the way the test is structured is that even if it's a broken part of the virus, it will still, because it's a target within the virus, the test will pick it as positive. But if you take that specimen and culture it, you will not be able to grow the virus. This is what has made us to change the guidelines, and we hope, as Madam CAS has said, this being a new disease, we need to gather more evidence to be able to inform us going forward. And that is why even when we implement home-based care, we must be able to do it judiciously and cautiously, so that we have the right people who have been given the correct information to ensure that they enforce the guidelines and protocols for success of home-based care. Otherwise, if you just let it be liberal, then you run the chance of actually causing more havoc by causing transmission at the household and community level. So that is why we are saying we'll take small steps to ensure that we move forward with each and every step and we don't make a mistake in the process. Thank you.